death, patient who died in the operation theatre, and this actually happened to me. So I had a patient who died, and I think I'll share some of the pearls that I learned, because this happened for the first time. May this never happen with you. So this presentation is based on an actual incident. Patient had multiple medical problems, including thyroid, diabetes, hypertension, heart disease, severe obesity, collagen disorder. Patient was flown in from Indore with bilateral corneal perforation. So it was a bilateral recent onset corneal perforations. The eye surgeon from Indore rang me up and said, I don't want to touch this patient, you please do this. So the relatives, when they came, were explained the necessity of general anesthesia, because I couldn't operate this patient twice. Huge obesity, very difficult to fit on the OT table. And I discussed with the anesthetist. We spent about 1.5 hours prior to the procedure discussing the risk factors with the patient's relatives. There were at least 4 or 5 relatives who had accompanied the patient. So we discussed for about 1.5 hours, myself, my anesthetist, and the relatives of the patient, that we, in spite of all risks, we still have to give general anesthesia, and we have to do bilateral amniotic membrane grafts to try and save the eyes of this patient, and that the patient will require subsequent surgeries later if we can prevent these 2 eyes from going into phthisis. They were specifically briefed about the possibility of death on the table. The anesthetist told them that it is a very high-risk anesthesia and he may not survive the surgery. The inevitable happened. The patient had successful surgery. Luckily for me, the patient came out of anesthesia, was wheeled out of the OT on a trolley, and he said hello to the relatives. So all the relatives crowded around. He gave a very weak hello to all of them. He waved his hands. Then he had a sudden cardiac arrest while they were taking the patient from the operation theatre to the ward. He had a sudden cardiac arrest before he could be shifted to the room. Of course, we wheeled him back into the operation theatre. Anesthetist was there at the same time. All attempts to resuscitate completely failed. I am in private practice. I have a general hospital just across the road. So we called the ambulance from across the road to shift the patient to the ICU across in the opposite building. But the cardiologist who came with the ambulance declared him dead and said there's no point in shifting him to the hospital. He's already dead. He's passed away. So what next? Relatives were initially quite understanding. They said, give us the body, we'll take the body back to Indore by train, because we had spent a lot of time speaking to them. I refused. I called in the police after making sure that my operation theatre notes and the anesthetist notes were complete in every way. So then we called the police. The police took their own sweet time in coming. The police station is about 5 minutes away from my hospital. They took almost 1.5 hours, 1 hour 15 minutes to come. Then asked me why we bothered to call them. They said, just get a friendly neighborhood family physician to certify that this patient died and give a death certificate, and they can take the body to Indore. Why are you troubling us? So police typically work at a snail's pace because they want to make some money in this process. So police requested me to get a friendly family physician to certify the cause of death as heart attack. And just mentioned that nothing happened. Patient came into the hospital, he had a heart attack and died. Give the body to the relatives. Relatives also telling me, give the body to us. We understand that this could have happened. I refused, and I urge you also to refuse, because you can get into legal trouble later. So then the cops requested for 5 witnesses. In Mumbai, that's called a Panchnama, where punch is 5. So you're supposed to get 5 witnesses to be present while they talk to the relatives. The cops explained the further procedure to the relatives. First, they will do the Panchnama, they will make their own notes. Then they would send the body to the state government hospital, which is called the JJ hospital, where a post-mortem would be conducted, authorized by the coroner. Then the coroner would issue the death certificate. This would have to be taken to another government office, which would then issue a permission certificate for the body to be taken out of the state. And the police made it sound as if this is almost impossible to achieve, and it will take perhaps several hours and maybe a day or more to achieve all this. The cops took their time, but since I had a clear conscience and the relatives so far were cooperative, the cops were getting quite frustrated. So they took 2 hours in my hospital to record 2 pages of statements. There was really nothing much to record. Then they called the government hearse to take the body to the JJ hospital morgue. Now the relatives were getting tired. They'd been up at it from morning, and it was now evening by the time the body left my hospital. Sensing this, when they reached the hospital, the morgue peons told them that there were other bodies in the queue, and things could get delayed by hours unless they gave him speed money. So relatives are now tired. It's been about 8, 12, 10 hours. The class 4 employees in the morgue are pressurizing them to give speed money. I had sent my hospital manager with the patient's relatives. In spite of my hospital manager instructing them, they readily agreed and gave the peon all the money that they had. The post-mortem was then finished in less than an hour and a certificate was issued. The morgue attendants themselves accompanied the body and relatives to the railway station, completed the paperwork required, actually delayed the train by 10 minutes. If I was the governor of Maharashtra, I could not delay a train by 1 minute. But these class 4 employees managed to delay the train by 10 minutes, put the body in the luggage compartment. Relatives, they got them second-class compartment tickets for an 18-hour trip home. What are the lessons to be learned? Take the relatives into total confidence. If patient is bad risk, spend more time, huge amount of chair time, tell them about it before surgery. If death occurs, stay cool, complete your paperwork. That is the most important thing. All your paperwork, anesthesia notes, everything should be complete. When death occurs, don't leave your hospital under any circumstances. I'll give you a story of another eye surgeon who had a death in his hospital. He got scared, he left the hospital and went home, leaving the resident doctors to manage the relatives. Relatives who were cooperative, got totally uncooperative. Where is the operating surgeon? He's run away. So there must be something fishy, and they created hell for that doctor. And the cops also created hell, saying we want to record the doctor's statement. We don't want to talk to the junior doctors. So stay cool. Don't leave your hospital under any circumstances. Continue to talk to the relatives all the time. Understand the law, call in the cops, insist on this. Insist on calling the cops even if the relatives don't agree, and getting a post-mortem done. Because there are 5 relatives here, there are 25 relatives at home. Those 5 here are cooperative, those 25 outside may not be. Read page 13 and 14 of the AIOS-CME series on legal aspects of ophthalmology, compiled by our own AIOS member, Dr. A. Deshpande, who is a lawyer as well. He's written it very well about what needs to be done. So this AIOS-CME series is available on the web also, and of course physical copies. Understand that you cannot be arrested. Nowhere in the country can you be arrested. It is a cognizable offense under section 304A according to Supreme Court ruling, but there is no arrest of the doctor. A death at our hands, either with consent or without consent, if the surgery or treatment is done in good faith, earns us exemption from arrest under sections 88 and 92 of the Indian Penal Code. Number 3, don't try to bribe the cops. Don't submit to blackmail by relatives or pay them money to hush up the matter. Don't talk about money, because then it feels as if you have done something criminal. There is nothing for you to hide. These things can happen. At most, you may not charge your surgical or nursing home charges, or if you've already collected the charges, you may refund those charges because the patient has died. That is up to you as a goodwill gesture, making it clear that this is not an admission of guilt. This is important. In conclusion, don't wash your hands of the situation. Stay there, stay with the relatives, stay with the cops, stay in control. You should be the person in control. Don't allow the police or the relatives to get into control. And you will never need to spend a minute like this if you don't panic. May you never face such a situation. Thank you so much for your attention.